Those are, so, many years ago, I was cross-cutting with a physician that had an alcohol problem, and he eventually died. What they did was, when he pulled his license, went to rehab, and then he would come out and be monitored with drug screens. Is that what y'all do, or they just another licensing board?
To a large extent, that's what we do, except for if most of the time we can keep the issue from getting to the level of a license suspension.
And then the licensing board, what they did with him was they gave him 3 shots, and on the 3rd time, then he lost his license from him. And that's usually how it works. So.
Yes, sir. Yes and no. It's changed a little bit. I don't think they put an actual number on the number of times you can be involved with our program. Usually, if there's a relapse after the 2nd relapse, which would be the 3rd time, they require a monitoring contract for as long as you practice. The way, in general, the way it works is the Louisiana State Board of Medical Examiners or a hospital administrator or a colleague will refer someone to us. Say, we think this person may have an issue. This is their name, and that reporting is anonymous. If it comes from the board, then the board will send them a letter, send the person a letter and say, there's a concern about your possible impairment and your health. Please contact Dr. Hammond at the HPFL within 5 days. Once they contact us, we set up a meeting where they come in, and me and one of my case managers, Felix, and I will sit down and discuss the issue, what's going on. You know, there has been some concern about your health. What do we need to know? What can we do to help? In the last year, we had 77 people referred to us in that manner. Of those, 46% of the people I met with, their cases were closed after that meeting.
So, and then one thing to remember, and I'm sure everybody's aware of that, but your license requires that if you notice one of your peers has a problem, it has to be reported to the licensing board. So if we reported it to you, does that preclude us from having it reported?
Yes.
To the licensing board?
Yes, and that's one of the unique and great things about the way the system has been set up in Louisiana. It's not that way in every state. If someone has an issue and they're referred to us for the first time, then I work with them and we can get them into a treatment program if they require that. We can get them into monitoring, and we can keep them anonymous from the board. The Louisiana State Board of Medical Examiners does not have to know about them. They can remain confidential. Now, if the 2nd referral, if they've been through treatment, been through monitoring, and then now they're returning, that is, I'm obligated to report that to the LSPB. But we have, what I was going to point out is, there's a rumor out there, and I've been fighting this rumor since I took this position 4 years ago, that everybody that gets sent to us is going to get some form of treatment. You know, coming to see me is the same as having to go sign up for an eval treatment. That is not the case. And that's why I bring up 46% of the people I met with, that's all we did. There wasn't enough evidence, or there wasn't enough to warrant moving to the next step. So that's almost half, which I'm proud of. I think we do a pretty good job of determining who needs the next step and who doesn't. Of the people that we sent, of the other 54% of the people who went to the next step, that step was a professional evaluation. They're done inpatient at one of 14 different facilities that have been vetted and approved by the LSPB. It's a 72-hour evaluation, and they try to determine what type of impairment, if any, and what the remediation would be. So as long as the person goes through that process, again, I can keep them confidential from the board, and there's no licensure action. The people who get licensure actions are the ones that say, I'm not going for the eval. You can't make me go for the eval. And they're right, I can't work voluntary program. But if you don't, if there's a suspicion, and I've asked you to go for an eval and you refuse, then that's reportable to the LSPB. Yes?
This might be a weird question, but of those people that the 47% that you deem don't need any further evaluation, do you have some idea of how many of them maybe actually go on later on to need further evaluation?
Yes. In the last, since I took over 4 years ago, there have only been It's around 5%, 3 to 5%. Are there people out there that needed help that we missed? Probably.
More borderline and needed help later.
And we do have a track. If someone doesn't meet criteria, and I don't think it rises to the level of sending for a professional eval, which if you think about it is a pretty big deal. If we get a referral and we sit down and we say, we want you to take 3 days off of work, we want you to pay between $3,000 and $5,000. We want you to go spend 3 days in an inpatient mental facility, which is what it is, and undergo this evaluation in order to continue to practice your profession. That's a big deal. There has to be enough evidence there that something's going on. It can't just be, it's taken very seriously. And we try to make those decisions as best we can. But yeah, we're human. There may be people that we've missed. One of the nice things about the way the process works is once I meet with you, we sit down and talk about things. I give you my card, even if there isn't enough evidence to warrant sending someone for a professional evaluation. I try to get enough of a rapport so that I can tell them, if you need help, we're the ones to call. Because again, we're not the licensing board, and if it's your first time being referred to us, I can keep you confidential from the board. So we can get you help and save your life as well as your profession, and there's no downside to that. But again, getting physicians especially to ask for help is tough. Yes, sir.
For dinosaurs like myself in private practice, is there one thing that's just sticking out all by itself, the lead horse running away, that causes any kind of problems with burnout? Like my office today, I'm kicked out of my office because an insurance company's coming in to do an annual audit for me, and my staff has been banging computers for 5 days now and not giving me any help, so I can go ahead and kiss the butt of insurance companies to try to make some semblance of an income. And I've been doing this now for 47 years. I'm just watching my income dwindle, dwindle, dwindle. I'm doing surgery for a handful of pennies. They're bundling me. That's the kind of frustration that is that part of what this thing is? Is that out in front?
Yes. On all 3 of the generational divides, they listed the bureaucratic process and paperwork as the #1 contributing factor. That is what you're describing. The bureaucratic process, what you have to do just to be able to practice your profession and be compensated at a reasonable rate, that amount of time that you're spending doing it now is several orders of magnitude greater than it was when you first started practice.
Well, maybe you could put me on Xanax for that, but you're not doing anything about the root cause of it. There's no answer to the root cause. Doctors don't have the guts to stand up for themselves and defend themselves against corporate enterprises.
Yes.
And we're just going to die. We're just going to dwindle and dwindle until there's nothing left. We become a little socialized medical assembly, and that's all it will be.
I think you're probably not far off. I think that's probably to a large extent going to happen. I went to a conference in Toronto, Canada, and the conference was Physician Wellness and Wellbeing. So I went thinking it was going to be a lot like what my talk today is, how bad things are and why are they so bad and how will we make them better. I was shocked that in the 3 days I was there, all of the physicians from across the world were there talking about how great their lives were. It was only the United States physicians that were there pissed off.
Yep.
The Canadian physicians were very happy. The UK physicians were, even the Chinese delegation.
Well, they're giving into socialism. I mean, they see patients and they just get the automatic check comes in from one end. And they're trying to push that in this country too, so that's the next door to open.
And I think the lesson that I learned is we, as a group, me included, because I'm a licensed physician, we've created a system that is killing us. So it has to change. And it will change eventually. Maybe not in my lifetime, but eventually people will get fed up and it will change.
So you're mainly just doing screening, you're not actually, you're screening and then referring for intervention?
Right. I view my role as connecting the people who need the resources with the appropriate resources. We have 14 places that I've visited that we vetted along with the Louisiana State Board of Medical Examiners that do the professional evaluations and do treatment if necessary. And then we have a contract that is based on the Federation of State Physician Health Programs contract that we use to monitor. Everything we do is based on the outline and template from the Federation of State Physician Health Programs. There are now 49. There's only one state that doesn't have one. You can probably guess. It's California. They had one, and then they sued it into oblivion, so it's gone. So in the state of California, if you get a DUI, you lose your license. There's no PHP to refer to. They just send you a letter and say, stop practicing. So people think that our program is onerous or that we're somehow an arm of the LSBME. We're not. We're the get out of jail free card. If you work with us, not only can we get you healthy, monitor you, make sure you practice with skill and safety, we can save your life and your license. So yeah, but we don't do the evaluations. Before I took this position, I spent 5 years doing evaluations at one of the facilities. So I've done the evals. But we don't do them in-house now. In order to do a professional evaluation, it's actually quite expensive. You need 2 physicians, one board certified in psychiatry and another board certified in addiction medicine, and they can't be the same physician. It has to be 2 separate opinions. You have to do the psychometric testing, the MMPIs, and fill in the box. So you need a PhD level psychologist to do those. You have to have facilities to keep people for 72 hours and provide for them. And then you have small groups and large groups where they're able to participate in 12-step meetings and things like that. So there are 14,000 different rehabilitation centers in the United States. We have a list of 14 that LSBME feels comfortable doing evals for us. So yes, there are probably more, but that gives you an idea of how only the top of the top are able to establish these diagnoses for physicians. And airline pilots, lawyers JLAB program, anyone with a fiduciary responsibility to the public.
So
Yes.
also those patients, those people that are referred to you that don't need to get the 72-hour evaluation, but may admit to you or whatever about having depression, burnout, other kinds of issues that need, that maybe would be they would benefit counseling. You have recommendations for them where they can go and get that
Absolutely.
service?
And actually, you want to talk a little bit? I'll let Felix, he does most of the hard work, and that's the hard work part, getting the people to the counselors. So I'll let him go ahead and address y'all for a little bit, and then I'll take some questions. So Dr. Hammond, you guys kind of already asked and answered a lot of what we do as a foundation and our procedural questions. So I'll kind of start from the beginning to kind of give y'all an overview again, and then if you have another specific question, we can kind of develop into that. So we are a physician health program. Our official title is the Healthcare Professionals Foundation of Louisiana. We were founded as specifically for physicians, but we've expanded obviously through the years to encompass the dentists, the other licensees from the LSD, the audiologists, etc. What we do in a practical sense, though, and I'll start with how we refer to us, and then kind of next steps like you just asked about. Say you have a colleague, you get arrested, and the colleague doesn't know where to go. They got arrested for DUI, they've been having some drinking problems at work, they don't know where to go. Either the individual themselves, or oftentimes a peer at work, or a family member, sometimes a spouse especially, will call me and say, hey, what do we need to do? Like everyone said, we accumulate evidence. We don't just make gut decisions off of anonymous calls. We'll look at the arrest report. We'll take, collateral information. If there's enough information to warrant the next step evaluation, that individual goes through the evaluation, and then is distribute recommendations based on their mental status at the time of evaluation. Those can range from a monitoring contract to ensure whatever treatment or whatever necessary steps were accomplished, or rule-out contract to identify any at-risk behavior or diagnoses that don't quite fit the treatment level of diagnosis, but need some attention called to them. Or nothing, like Dr. Hammond said. Almost 50% of our people come to us, we discuss with them, we see what their next steps are, and it's not anything. And then to that end, but they want a therapist. They're burned out. They don't have a diagnosis attached to that burnout quite yet, but they're on that pathway. Well, we can set them up with therapy. I'll often use a psychiatrist is the next first step to say, hey, go to the psychiatrist, see what your needs are, and then go to a therapist that they recommend. Or I can get individual counselors set up depending on what area they're in. Of course, areas like New Orleans, Baton Rouge, Shreveport have just more resources. So in those areas, it's a lot easier to accommodate and facilitate. Whenever we look at some of our rural areas, that is a more difficult and arduous process. There's not providers there to offer those services. So then we try to set them up with somebody in a more tangential program where they have once a month therapy or whatever from a different area. But we try to encompass everybody, but where they're at, sometimes play their role in how that moves forward. Does that answer your question a little bit? Anybody else have any questions about that?
Surely you've expanded services with telehealth now.
Yes and no. So a lot of our psychiatric evaluations and such, they need to be done in person, given the depth of the evaluation. However, a lot of our meeting requirements are aftercare and therapy for our post-treatment and contracted participants. It is being done via Zoom, telemedicine, yes. But for the individuals coming into the program, usually in-person meetings are still required at this time. So let me discuss a little bit what a PHP is in a meta perspective, and kind of Dr. Hammond touched on this a little bit. Why do we exist? What benefit do we actually provide for you guys? Nobody wants to be forced to go to an evaluation. Nobody wants to pay money out of their personal pocket to come work with us. In fact, most people are very angry when they get told that they have to do that. But really, what is the benefit for you guys as the licensees, and why should y'all care? Well, like Dr. Hammond mentioned, some states, specifically California, and even other states, don't have good relationships with their licensing board and their physician health programs. There are many states out there that if you get a DUI, like Dr. Hammond said, or any kind of diagnosis of mental health in any capacity, you're barred from work for at least 12 months. In California, you have to have a formal hearing that's public record. In Louisiana and in many other states, we have what's called the Federation of Physician Health Programs, which we work together to build and foster relationships and rapport with the medical boards in the physician health programs to allow them to remain confidential. Because if you have a formal board hearing, it's public record, and that's not conducive to y'all's practice, to your mental health treatment, and to your recovery in that capacity. So we like to intervene between that and say, no, let them come to us, we will treat them and give you clearance that they're fine. And actually working with the health credentialing department, this is one of the biggest areas I run into is I release as little information about you guys as possible. People have to ask me for more information. And that's our job, is to keep y'all's care and y'all's mental health statuses as confidential as possible. It's nobody else's business, to be honest with y'all's diagnosis, where if y'all been treated and returned to work, that's y'all's business. We accept those records and keep them as stewards of those records, but that will never be re-released. An additional thing is it promotes additional referrals to us by keeping that confidential. If you know that you can refer, say, a friend that you've known since medical school for help, and they're not going to lose their medical license, you're much more likely to do that. If everybody that you refer to gets into the board for a legislative hearing, then nobody's going to refer to us. So confidentiality kind of is the benchmark of our program, and that's why we exist. Anything else? All right. Well, we have some pamphlets outside about how to contact us. If anybody needs help, whether it's here or anybody else contact us, call us. It can be a conversation, it can be an email, it can be an official referral. Referrals can remain anonymous. You can refer yourself, or you can just call for questions. I've had people call me for credentialing questions about how to work with the board, just for general capacity questions, and I can kind of intervene and call the board and ask them, so you can remain confidential, and various things like that. So whatever you think you might want to discuss, and you don't want the board to find out about it, or you just have general questions that you're unsure how to proceed, contact us, and we can help navigate a lot of those licensing issues. Okay. Any other questions, comments, concerns? All right. Well, thank you guys so much. Let's get some campus outside.
Please take a moment to complete your evaluation forms, turn them in the front desk. Thank you all very much.